So this is the webinar series that we had perspectives from the field. We featured all types of experts. We started the webinar series at the end of July, and as I mentioned, today's session will be the final webinar in the summer webinar series. We've talked about everything around from affordable housing, demographic projections, legal frameworks, and international responses. We even last week had Dr. Brian Ragsdale speak around mental health challenges for climate-displaced populations, which is a nice segue for today's webinar on public health challenges for climate-displaced populations. So next slide, please. This slide, I'm going to introduce our presenters. So we have Dr. Shamarial Roberson. She is a nationally recognized expert in health equity and public health administration. She currently serves as the Chief Executive Officer for DSR Consulting and Management. She's also President of Health and Human Services at a private firm. In this role, Dr. Roberson bridges gaps between government agencies and communities to advance health equity, particularly for vulnerable POPs. Formerly the Deputy Secretary of Health at the Florida Department of Health, Dr. Roberson demonstrated exceptional leadership during the COVID-19 pandemic, and for over nearly a decade at the department, she managed a $2 billion budget in pandemic response funding and played a crucial role in advancing health equity and ensuring resources reached minority-serving organizations. Dr. Roberson holds a Bachelor of Science in Family and Child Services, a Bachelor in Science in Biological Science, and a Master of Public Health in Health Promotion and Health Policy from Florida State University. And Dr. Roberson holds a Doctor of Public Health in Epidemiology and Biostatistics from Florida Agricultural and Mechanical University. Our next presenter and expert is Dr. Sade Collins, Collins. Dr. Collins is an accomplished public health leader with extensive experience in both government and academia. Dr. Collins' expertise includes health education, health promotion, health equity, program management, contract and grants acquisition, health communications, data analysis, and strategic planning. Dr. Collins has held significant roles within the federal government, and she holds a Doctor of Public Health from Florida Agricultural and Mechanical University. Dr. Collins' career has been dedicated to improving public health through strategic initiatives and comprehensive health programs. So at this point, I'm going to stop and let Drs. Roberson and Collins take over. Dr. Roberson and Collins.
Good afternoon, everyone. I'm Dr. Roberson, and today we're going to really discuss the public health challenges associated with climate-displaced populations. We're going to talk about the energy implications, but more importantly, we're going to talk about a call to action and how we can build resilient communities. Again, I'm joined by my colleague, Dr. Collins. And, with really going into my background and, why, my life is devoted to advancing health equity. I grew up in a small rural town in which, we were very under-resourced, lack of food, lack of access to healthcare, lack of educational opportunities. So I knew from a very early age that I was really committed to advancing those social determinants of health, where people live, where they work, where they play. All of those things will ultimately determine, health outcomes. But what I've learned with emerging issues, and especially public health issues, is that, some of the most important drivers around healthcare are non-healthcare related. So looking at energy, looking at food, looking at geography, looking at climate impacts, all of those things are ultimately important for population health. With that being said, I've really focused the last year on working in the policy space. So advancing and writing model policy to advance health equity. And again, health equity is really looking at giving people what they need to ultimately reach their optimal health outcome. And that's regardless of race. That's looking at historical injustices, racism, It's also taken a look at contemporary issues such as climate. And I've dedicated my life to, expanding this concept in practice as well as in academia. I currently serve as a professor at Brown University, really focusing on public health communications and how to really, make sure messages are culturally competent and sensitive, and especially for marginalized communities. I'm joined here by my colleague, Dr. Collins.
Good afternoon, everyone. Thank you all for allowing me to be present in your space. And so, as Dr. Roberson mentioned, as well as Dr. Thomas, I come with a wealth of experience, and my approach to public health has been really driven by community-driven solutions, where the voices and needs of people really guide the strategies that I have been able to implement in both state, local, as well as federal government. And so, understanding that advocating for healthcare policies and working collaboratively with diverse stakeholders has really been my goal over the past few years, and ensuring that there is impactful change that improves the overall well-being of communities. So I'm really excited to be joined with you all today on such a critical topic, and looking at it from a different lens in terms of the energy space and the cross-section with public health. Thank you. Dr. Roberson?
Thank you. So we're gonna go directly into talking about, and defining climate-based displaced populations. We're gonna talk about, how these events, really affect vulnerable populations. We're gonna talk about the intersection between energy and public health and implications for that. We're gonna more importantly talk about, how to address these challenges, how to work to bring solutions, how to foster resilient communities, and a call to action. So when you really look at climate displaced populations, we're talking about populations. And when you think about a population, populations are not the same. You have individuals that are unhoused, you have individuals with disabilities. Looking at different states, a lot of my experience in Florida, it's a very diverse population. So 67 counties, over 100 million plus visitors. You have populations that are snowbird populations. So what that is a part of the year they live in the northern region of the United States, a part of the year they live in the southern region of the United States. But what I'm telling you is that these climate displaced populations, due to the result of, heat or the result of a hurricane, these are individuals that are forced to move from their current environment. And these things have been exacerbated in recent years due to rising sea levels, due to the intensity of storms from hurricanes, right? Due to droughts, etc. And the way that populations are affected are very different, right? Based on where they live, where they work, where they worship. Different populations experience this displacement differently. Sudden loss of homes from a tornado or a hurricane can cause displacement. When you look at all of these different things, basic needs and how we partner will really affect, these populations. And some of the populations that are marginalized, they feel the effect of displacement in a disproportionate way when compared to other individuals. So if you look at a person that's homeless, they may not have the means to be able to quickly get up and migrate in the event of a hurricane. So they are left at the mercy of government, community partners, to especially, overcome something like a hurricane. When you look at the classification of these groups, so you have people that can be temporarily displaced, for example, during a hurricane. So say they have a house that's flooded, they could, have that mitigated and temporarily and return back to their home. But say, for example, you have a hurricane that includes tornadoes that are catastrophic and their home is completely lost. These are individuals that may be permanently displaced. You have, some situations where families, individuals have decided that they are going to voluntarily migrate due to the effects of hurricanes. So if you look at the northern region of Florida in the past year, there have been 2 hurricanes that impacted the same area. Some individuals have decided to move away from this region because they think there's an increased risk for these storm events. So they have the means, they have the money. When we look at those marginalized communities, they can't always move in a voluntary way. But then you have forced migration, and that is, something that can happen suddenly, like a tornado that happened in Tallahassee, Florida in May. It was unpredicted, unplanned, and some individuals lost their home, and it forced them to move either with family members, if they didn't have the means, or it might have forced them to move, sometimes out of this region if they had to move with family members far away or get other means. You can have internal migration where people move around, certain areas of town. Maybe they just move to a different housing location, or they move within the county. But you can have people that move within states. However, when you look at the United States, for example, it's surrounded by islands, for example, in Florida. You have the Bahamas, you have Haiti, you have other places, the Virgin Islands, and a lot of times with storm events, individuals will move. So, for example, when there was a hurricane in the Bahamas, there are huge implications for this from a public health standpoint because often students will move into, Florida. Those are their migration plans, and you have to deal with things that we'll discuss. And when you think about, setting the tone for resiliency, you have to look at proactive migration where, if somebody is in a low lying area and it's continued flooding, looking at mitigation strategies that are sometime, funded by FEMA, other agencies. And then, you want to prevent really reactive, migration where people had no plans and then they're just forced to move. When you look at the historical context and where we're going, related to disasters, public health emergency implications for energy, during all of these events, Hurricane Audrey, you can see that hurricanes have affected the United States as far back as the 50s and beyond, but they're becoming, more intensified, and you can see these things. When you look at things like Zika, oftentimes people don't think about climate, but due to the increase in water, due to temperatures, there has been a migration of vectors like mosquitoes that carry viruses like the Zika virus. So when thinking about climate effects, it is important to look at it from a multifaceted lens. When you look at the increase in the intensity of wildfires, they are increasing in places like California. And when you look at heat waves, huge implications for the intersection between emergency management, because anytime there is a declared disaster, often states move into an incident command structure and they have to work very closely with emergency management. And that is an accepted type synergy between the fields. What I'm proposing here today is it is important to really talk about energy burden, energy resiliency, because during a lot of these events, wildfires, hurricanes, heat waves, et cetera, there are often problems with energy. Almost, 100% of time when you're looking at these events, hurricanes especially, there will always be power outages. So, planning for these resiliency hubs around energy is very important. So when you look at Hurricane Katrina, and we're really talking about the reason for planning and resiliency, in that it is estimated that, more than 1,800 people, they, sadly passed away and over 1 million people were displaced. That is the effect of climate migration and displacement, right? And then with over 400,000 people having to find new homes, they often go to neighboring states, but there are huge implications when you look at these storms, especially, from an equity lens. So individuals who often have, a lower social economic status, who don't have access to food, who often don't have access to healthcare, these are the individuals that are mostly affected by climate events like hurricanes. So it is important that we plan for this. And when you look at the economic impact, Katrina cost over $161 billion. And when you look at these trends overall with wildfires, again, in 2018, for example, the Camp wildfire, it displaced more than 50,000 individuals and, cost over $16 billion. So as we have effects of climate, the economic burden on the government, on individuals, on communities, it is significant. So coming up with mitigation strategies to these, climate events are very important. So one of the emerging topics, where it's really going to take a multifaceted approach is really looking at the increase in hurricanes, specifically to the southeastern part of the United States and places like Florida. Again, I noted earlier that Hurricane Debbie, Hurricane Idalia, for example, Hurricane Ida have affected Florida significantly in the past few years. You had areas of Florida, for example, that hadn't seen a hurricane in over 15 to 20 years. Now, those areas, for example, with Hurricane Debbie, have seen the same type of pattern with a hurricane in less than a year. Those are huge implications for energy. So in some of the rural communities in North Florida, like Madison County, they had entire energy grids that were damaged and had to be replaced. So people were without energy sometimes for more than 7 days. And with the frequency of the storm, they started to fix, energy systems, but not at a rate that could, keep up with, later storms. So individuals in those communities are reporting more frequent power outages during regular rainstorms. In addition to that, there has, been a broadening of a digital divide, right? Broadband is a huge issue. So with these storms and the weakening of broadband expansions, it is important to make sure that they receive, additional support, especially in rural areas. So there's an opportunity to further make a resilient energy system because due to climate changes and the strengthening of these storms, there is a significant impact, and especially on marginalized, under-resourced, underrepresented communities. So what can we do? So how do we move forward to really create a system where equity is advanced and specifically, public health? So, in these events, leveraging data systems. And when I say data systems, I'm not just talking about healthcare data systems. I'm talking about energy data systems. I'm talking about emergency response systems. You need historical contemporary metrics as well as real-time metrics to be able to, come up with a data-driven approach. Cross-sector collaboration, so working with historically Black colleges and universities, minority-serving institutions, making sure you're working with faith-based organizations, making sure you're working with other community-based organizations, working with energy partners is important. One of the most important things that's understated when dealing with climate issues, dealing with emergency management issues, is the need to create a workforce in a community that really understands the incident command structure and how do you navigate resources during a disaster that can, stem from climate is important. There are a lot of things in public health, like community health workers, who are there as lay members of the public, but they are designed to be a navigator between government and the public to ensure that all of these services are culturally competent and that we are being intentional about working with marginalized communities. There are huge tribal communities across the US as well as Florida. So there are recognized tribal communities like the Seminole tribe, for example, and there's a huge population of unrecognized tribal communities, for example, in northeastern Florida. So making sure that you're intentional about planning to ensure that we have a culturally competent approach to addressing climate issues is very important. And then, we need to ensure that strategic plans are in place so that we are in alignment prior to a disaster. We understand, and the data is showing us that the effects of climate are increasing rapidly. So it is important that we're intentional about building workforce, building research systems and making sure that the disciplines are in alignment for synergy to improve outcomes, and especially amongst vulnerable populations.
Right, so thank you, Dr. Roberson. So as has already been mentioned, vulnerable populations, including like the elderly, children, and people with disabilities, and low-income individuals and marginalized communities often face disproportionate risk during disasters and public health emergencies, right? And so these groups are more likely to experience severe direct impacts due to their limited access to resources, to healthcare, as well as social support systems. So whether dealing with natural disasters like hurricanes or wildfires, or even public health crises such as pandemics, these populations are often less equipped to prepare for, respond to, as well as recover from such events. So understanding and addressing these direct impacts is very important for developing effective public health strategies that ensure the safety and well-being of all community members, especially those who are at risk. So when thinking about some of those direct impacts of vulnerabilities, food insecurity due to displacement, right? So climate-induced displacement often disrupts access to food, leading to food insecurity in affected populations. And these displaced individuals may lose their agricultural land. They may lose their livestock or even other means of livelihood, severely limiting their ability to obtain or even produce food. Additionally, the loss of infrastructure and access to markets further exacerbates the situation. So, loss of livelihoods, what exactly does that mean? That's displacement, frequently separating people from their primary sources of income and food production, such as farming and fishing. And then there's dependence on aid. These displaced populations, they often rely on humanitarian aid, which may be insufficient or inconsistent, leading to chronic hunger. And then sometimes there are nutritional deficiencies, something that's not really talked about a lot. But limited access to diverse diet could result in malnutrition, particularly affecting these vulnerable groups like children, pregnant women, as well as the elderly. And then there's an increased spread of diseases. So displacement often results in overcrowded and unsanitary living conditions, which can significantly increase the spread of infectious disease. So lack of clean water, proper sanitation, and healthcare services in temporary shelters or camps can create this breeding ground for disease outbreaks. So just waterborne diseases, for example, are results of poor sanitation, limited access to clean water, which could increase the risk of diseases like diarrhea, as well as cholera in some cases. And then you have these vector-borne diseases, which are caused by maybe overcrowded and living conditions can facilitate that spread of disease. And depending on where you are, like malaria, dengue fever, and especially in regions where these diseases are endemic. And then respiratory infections, right? When people are in these close quarters and displacement camps, it can lead to the rapid spread of respiratory infections, including tuberculosis and COVID-19 in some cases. And then the third area are these strained and overwhelmed healthcare systems. So this influx of displaced individuals can place a significant strain on local healthcare systems, which are often already under-resourced, right? And so this sudden increase in demand for medical services can overwhelm healthcare systems, leading to the decline in quality of care and the inability to meet basic healthcare needs of both the displaced as well as the host populations. And so some of these limited resources could be the lack of necessary medical supplies, the lack of staff, the infrastructure to really handle this increased patient load. Sometimes there could be delayed care, right? So overwhelmed systems can lead to long waiting times, delayed treatment, poor health outcomes for both acute and chronic disease conditions. And then you have the host communities, right? So there is that additional burden on healthcare systems that negatively impact the local population, reducing access to care as well as increasing competition for scarce resources. So if we've ever been, I'm sure you have either been in a hurricane, tornado, fire, etc. It all relates. Next slide, please. So there's this very important intersection between energy sector and public health, right? So the way we produce, the way we distribute and consume energy has these profound implications for our health and well-being. So from the air we breathe to the stability of our climate, energy choices impacts everything. Traditional energy sources like coal and oil, they contribute to pollution and climate change, but which in turn, they drive these health issues, sometimes like respiratory diseases and heat-related illnesses. However, as we are transitioning to cleaner and renewable energy, there is a significant opportunity to improve public health outcomes globally, right? And so reliable energy access is important in addressing these immediate and long-term needs of climate displaced populations. So energy is that fundamental enabler for various essential services, including healthcare, including water supply, as well as food preservation. And so without these consistent energy access, these services can be severely compromised, exacerbating those challenges faced by these displaced communities. So some of these key points are foundation for essential services. What does that mean? Energy is the backbone of critical infrastructure in displaced settings. They support everything from healthcare to sanitation. And then there's resilience against disruptions, right? Reliable energy helps create resilient systems that can withstand and quickly recover from the impacts of displacement. And then improving quality of life. Access to energy improves the quality of life for displaced populations. So it enables those better living conditions, lighting, right? Communication, as well as safety. Powering healthcare facilities. As we know, when there's a disaster that happens or some sort of emergency, there may be places that are without power, and healthcare facilities are particularly dependent on reliable energy to function effectively. And without power, a lot of these medical services that are essential can be severely disrupted, putting lives at risk. So just think about it. Medical equipment. Reliable energy is necessary to operate life-saving equipment. This can be ventilators, incubators, as well as like dialysis machines. Lighting and climate control, right? Proper lighting is essential for emergency surgeries, any medical procedures, while climate control is necessary to really maintain that safe environment for patients and staff in a healthcare facility. Communication systems, right? Energy is very important and is vital for powering those communication devices, right? Ensuring that healthcare facilities can coordinate with other agencies, as Dr. Roberson mentioned about like doing an emergency response and providing those timely updates to patients and their families. And then there's the preservation of medications and vaccines, right? And that's another critical area that depends heavily on reliable energy access. So many medicines, including those life-saving vaccines, they require consistent refrigeration to remain effective. And so, and my experience kind of working in this space just a little bit is that understanding that cold chain requirements, right? So the need for vaccines and medications to be stored properly at specific temperatures, relying on reliable refrigeration because some of these medications could lose their potency, rendering them ineffective. Preventing waste. Energy disruptions can lead to spoilage of medical supplies, resulting in waste as well as further strain on limited resources. And then ensuring that there's a continuity of care. Reliable energy helps maintain that cold chain, ensuring that these medications and vaccines are available when needed. And then, of course, you have the clean water supply. Can't really talk about that enough, right? It's essential for drinking, it's for sanitation, it's for healthcare. And then sometimes in these displacement settings, access to clean water can be a significant challenge, right? Water purification is one of those areas. Energy is required to power those water purification systems that remove the contaminants and pathogens from water, making it safe for consumption. And then in some places you have water pumping, right? And in many cases, water needs to be pumped from wells or other sources, which requires a steady supply of energy. And then some of these sanitation facilities, energy is needed to generate some of the machines that are being used. So ensuring that there is medical equipment and communication systems, and also there's that clean water supply, again, for just preventing just any type of health crisis in displaced settings. Next slide, please. So addressing public health challenges really requires what we like to call this comprehensive approach that identifies the root causes of health issues and implements these targeted solutions. And in today's, I would say, complex health landscape, some of these challenges include environmental hazards, health inequities demand just across multiple sectors. And so some of the solutions that we think about, they must be data-driven. They must be sustainable, focus on prevention, early intervention, as well as community engagement. So by leveraging some of these innovative technologies, policy reform, and cross-sector collaboration, which we'll talk about a little bit later, we can create these really resilient public health infrastructure that not only responds to immediate crisis, but also builds this long-term wellness for all communities. And so to address these public health challenges in displaced communities, we need to really enhance our food security through emergency food systems, right? Understand and manage and prevent disease outbreaks with different types of campaigns around sanitation and hygiene promotion. And some of those strategies may include providing immediate food aid through humanitarian organizations to address acute hunger. It could be distributing food packs that meets vulnerable dietary needs of vulnerable groups, again, like children, elderly, and etc. Sustainable agriculture initiatives, right? So introducing these small scale agriculture projects such as community gardens or even vertical farming that can be quickly established in displaced camps or temporary settlements. Supporting displaced farmers with seeds and tools and training to restart their production in their new locations is also important as well. Strengthening our food systems, and what does that look like? Partnering with local communities and markets to improve their food supply chains, ensuring that displaced populations can access these locally produced food, and encouraging the use of local food resources to reduce dependency on external as well as its external aid and promote self-sufficiency. And then finally, there's that food storage and preservation, right? So implementing some food storage solutions that protect against spoilage and pests, as well as educating communities on some of these techniques to extend the shelf life of perishable goods. Next slide. Next slide. Thank you. Okay, so what does that look like? So displacement settings are particularly vulnerable to disease outbreaks, right? Due to overcrowding conditions, poor sanitation, and limited healthcare access. And so vaccine campaigns, actually, Dr. Roberson, you can go back to the previous slide. I apologize. Thank you. So yeah, so vaccination campaigns, right? As we saw with COVID, right? So prioritizing vaccination drives to protect against these preventable diseases like COVID-19, ensuring that the vaccines are available and they're properly stored. Sanitation and hygiene promotion, again, conducting these hygiene education campaigns to inform displaced populations about best practices such as regular hand washing as well as safe food handling. And then we have disease surveillance and these early warning systems. And so training healthcare workers or community health workers, as Dr. Roberson mentioned before, to recognize some of these symptoms and be able to report cases promptly. And then finally, access to healthcare and treatment, deploying mobile health units, right? That energy piece is required here to make sure that we are reaching remote and underserved areas within displacement settings. Next slide. So what does it mean to really develop resilient healthcare infrastructures, right? And so that's a really critical piece. It means we are strengthening our healthcare facilities. We are investing in the construction. We are investing in the renewable energy. We are investing in ensuring that these healthcare facilities can withstand natural disasters. We are equipping with these facilities with the energy power sources that are needed for when there's a disaster that may happen. We are also training healthcare workers, right? And what does that look like? Ensuring that there is support for well-being initiatives, ensuring that individuals know how to use some of these reliable energy sources when there is a power outage and et cetera within some of these areas. Integrating health services, right? So understanding what it means to have prevention programs for these displaced populations, and then always using this community-based health approach. So engaging displaced communities in the healthcare decision-making, in the service delivery, and ensuring that these services are culturally appropriate and it meets the needs of the population. Dr. Roberson, next slide.
So now we're going to transition to, being intentional about designing public health programs to include climate resiliency, energy resiliency. So during these emergencies and during, for example, extreme heat events, making sure that you can have immediately rapid response teams that include lay members of the community as well as public health members, mental health personnel to make sure that during a hurricane that you have a coordinated response strike team that's available to assist individuals with their basic healthcare needs and other needs, making sure that you have the availability of supplies. So water, having the availability of different things to stay cool, making sure that you have cooling stations during the immediate disaster like a hurricane is super important. But in the long run, making sure that individuals, even during a disaster or climate event, can have, access to things to control their chronic disease. Those are things like insulin. So, for example, diabetics during, a storm where energy is absent, you need refrigeration or the means to keep insulin, at the appropriate temperature. Making sure, like Dr. Collins said, that you work with those food programs to ensure that you reduce the risk of food insecurities during those events, as in a lot of areas there are current food resiliency problems, even during what they call in emergency management is blue skies, which is every day to day, right? So making sure that partnerships are there, not just during extreme climate events, but during, day-to-day operations and planning. So, collaborating with public health, energy sector, social services, like those human services for food assistance, making sure that you're looking at place. So after event, basic resources and assistance with utilities, assistance with rent, assistance with mortgage, are all important, and especially for under-resourced communities, because they may not have the reserve to be able to spend the money to, respond to a climate event or a disaster event that may not be related to climate, but making sure that the supports are in place with water and sanitation workers to make sure those vulnerable populations who are most often affected, that they don't have contaminated water, that they understand who to call if they have, discoloration of water or if they need help testing their wells. Oftentimes, lay community members, they don't know who to call and what to do. And then the collaboration with faith-based organizations, historically Black colleges and universities, community-based organizations, they often assist locally with community needs. So being intentional about these partnerships will help mitigate the effects of climate events. So when we really speak on fostering resilient, effective communities, what is our role? So being prepared, prevention, using data to drive the narrative is important. Making sure that we are intentional about groups such as JISEA and other groups to educate on this one. This is an emerging public health issue, as we don't traditionally have a lot of training, for example, in public health to deal with climate issues, right? It is something that I wasn't specifically trained on with my public health training, right? It is something that we should be intentional about developing curriculum to educate the current workforce, to educate our up and coming workforce, to educate our public on how to tackle this. This is a under-resourced, under-researched field that it is important that we bring together this commitment like this group here to make sure that we can mitigate the impacts of climate effect. And, Dr. Collins laid the foundation that energy is associated with everything that individuals, populations, communities need to be successful. And we understand that these marginalized communities don't have access to clean energy. These marginalized communities, they don't even know how to have the conversations to begin to understand how to mitigate energy events. So the use of agrovoltaics to increase food supplies, the use of green gardening and roof gardens that are green, the use of making sure that systems are available to ensure clean water, even looking at how houses are cooled because of heat effects, right? So making sure that the aging population, which is very prevalent in certain states, have access to have, cooling stations. In a lot of the rural areas, when really looking to address health equity, a lot of people, they don't still have in 2024 centralized heating and air. That is very prevalent in rural communities, especially across the southeastern part of the United States. So, having mitigation in place to help people cool off is very important. So when you look at a call to action, what should we be doing? And, one of the things about calling things to action is understanding the data. So we need to have publicly available data systems that really document all of these different components of vulnerable populations, how we can look at it from a historical standpoint, how we can look at it from a contemporary standpoint. We need to understand those social determinants of health, where the food insecurities are. Even if food insecurities aren't in an area, a climate displaced population could have immediate food insecurities, right? So educating the public on, federal programs like disaster supplemental nutrition assistance programs, which are designed to traditionally serve populations that may not otherwise be served with SNAP benefits from USDA, educating the public on who can access those services, making sure that plans are in place prior to climate events to deal with disease spread, right? So the use of solar energy and other things to really make sure that, populations in healthcare systems such as long-term care facilities, nursing homes are full. There are policies that are model policies to make sure generators are available. But in addition to that, that's mostly in long-term care facilities. There is a need to be intentional about making sure temporary cooling devices are available to the aging, vulnerable populations that may have, weakened immune systems, right? Making sure that medications are available. So there's model policies in states that are prone to hurricanes and tornadoes that will allow for individuals, like in Florida, to access a 90-day supply of medication. That model policy should be discussed and spread across the United States to ensure that people can mitigate the effects of chronic conditions like diabetes, hypertension, right? Making sure that community health workers, those workers that are lay members of the community, are educated on energy resiliency, how to be the boots on the ground to make sure that the canvassing is being done. One of the things that people often don't, assess is that during an emergency related to climate, when energy is out, it's not just the energy, it is the internet as well. And making sure that people are educated on what to do if you lose power, if you lose internet. That is when canvassing those humanitarian type missions are very important. That is when public health information is spread by word of mouth. That is one of the most under recognized strategies for communications, that people say we can do everything on social media. During a storm event, often you lose access to cell phone towers or, radio networks, and you're not able to do that. So being intentional about having plans in place to communicate to affected areas are very important. But more important than anything, the call to action, being intentional about writing and putting into literature, writing white papers, putting it in the literature, and actually putting it in the lay public and in communities on coming up with a strategy, a backbone structure for really bringing synergy between public health, between energy, between human services to have a better impact is the most important thing. Today, we really focus on bringing together different disciplines. We really talked about the importance of really being intentional about coming up with strategies to mitigate climate. So looking at transient populations like the homeless, being intentional about having plans in place during climate events, looking at the aging population, being intentional about strategies to assist, looking at, other populations that are, underrepresented, those tribal populations, making sure that, information is available, and oftentimes looking at populations like the migrant populations that are very prevalent in those warmer states, but often underplanned for in the event of a hurricane is super important for bringing synergy.